Hello everyone, myself Dr. Sahil Patel, a consultant homeopath. So as we had discussed two videos from Dr. Borland's book, Dr. Borland has written many books on homeopathy as like children's types, digestive drugs for mother and infants for emergency cases, his therapeutics in day-to-day lifestyle for pneumonias, influenzas and all those conditions. We are currently discussing about the emergencies and the injury conditions, the therapeutics basically related to it. I am discussing about the short therapeutics where homeopathy has very good role in such conditions. So we had discussed about two conditions. First was about sprains and dislocations, second was about fractures, and now today we are going to discuss about head or spinal injury. So do you really think that head or spinal injury needs a homeopathic treatment? This is question, right? So the primary treatment is to be needed from a neurological or neurosurgical side. Neurosurgeon's treatment is must for the condition where direct head injury or the direct spinal injury is seen in the patient. Then the other thing is that after that treatment, or if the treatment is not needed from their side, homeopathic treatment can be given to those patients, which can really be very helpful for those patients. It is not that homeopathy doesn't help in those conditions. Homeopaths have very good remedies which have specific action on the head, even on the cerebellar part, cerebrum part, on the CSF part, even on the spinal cord injury. Homeopaths are having very good remedies which even work better on the nerves, which are typically related to the cervical region, which are typically related to the lumbosacral region. There are very good remedies where, because of the head injury, other manifestation of symptoms are seen in the patient's body, even in the patients who are having comatose conditions. Then also many homeopaths have given homeopathic remedies and the person's healing process was boosted because of those remedies. I'm not saying that our remedies will definitely 100% boost up the condition of the patient, but I'm telling that along with their conservative mode of treatment, we can prescribe our remedies so that the patient's life gets better. Our main purpose is that the patient is going to get healed up. So let us discuss about it. For any kind of head injury with a concussion presented, or for a spinal injury again with a degree of concussion, certain routinistic remedy which we have discussed in both the previous videos, which remedy can be given? The first remedy which I have told about was Arnica montana. But do you really think that Arnica montana should be given in these patients? No. My dear friends, always use Arnica montana wisely and only give to those patients where it is needed. For brain concussions, spinal cord injuries, where a blood concussion is present, we should not prescribe Arnica montana. If you even want to search that out, the blood thinners which are given from the conservative or the allopathic side of treatment, on many websites it is written that Arnica montana content should not be given to those patients. Why? Because Arnica montana's action is for neovascularization. It forms newer blood vessels, and because of that, what can happen? A person may go to grievous condition because of our fault. So use Arnica montana wisely in patients where blood thinner is going on. Use Arnica montana wisely in the conditions where head injury, spinal injury and the concussions are present. So in the case of head injury with mild concussion, the best prescription may be Arnica montana, but use that remedy wisely. Give only that remedy when the condition has become in the chronic condition where surgical intervention is not needed for that patient. Then you can give Arnica for that patient for resolving that blood accumulation. Next thing is that where the concussion has been much more of a spinal concussion rather than the head. If spinal cord is much more affected rather than the head, then Hypericum works very well. It is one of the very good nerve remedy for that patient. The next thing is that these two remedies were for the prescription which is on the immediate prescription. Then the next is that for concussion with persisting drowsiness seen in the patient with obviously increasing intracranial pressure, do not persist with Arnica montana. So make a star in your book write it somewhere in your brain, even in your books and notebooks, that Arnica should not be given in the patients where concussion is there, intracranial pressure is increasing, person is typically going with the persistent drowsiness in his condition. So which remedy can be given in these conditions? That is opium. Yes, my dear friends, opium has very good action in such conditions. Opium can be prescribed. Opium doesn't have direct effect on the vascularization. Yes, it helps on the drowsiness like symptoms. It helps in the intracranial pressure like symptoms, which leads to various further manifestations on the bodily level. Then the next thing is that when dealing with the later effects of the concussion, the post-concussion headache if the person is having, then the routinistic medicines from our side can be given. We have a very good remedy from the Natrum salts, which is Natrum sulph. It is one of the most useful remedy in the patients where head injury was, the complaint was before 6 months or 1 year. Even the patient says that before 3 years he had fallen down on the road traffic accident, and after that sometimes the pain increases. You can directly observe the modalities which are affecting in those patients. Natrum sulph can be given in those patients. Arnica is most likely disappointing in those conditions. It is for the acute prescription, as you all know. Then the next thing is that if Natrum sulph works for those cases, the next most useful remedy for that condition is opium. Yes, opium can also be prescribed if Natrum sulph like modalities are not present for those patients. The next thing is that when dealing with neurasthenic symptoms which have a spinal concussion, most commonly indicated remedy which I had told you was Hypericum. But other than that, after Hypericum, if a person doesn't get better from it, if cervical region is much more affected, if any part of the spine is affected and it causes neurasthenic conditions, then another remedy is Simicifuga or Actia racemosa remedy. It has very good affection on the cervical spine region after the injury in those conditions. So these are the remedies. These remedies can be prescribed for your patients in 30C potency. Use these medicines wisely, as well as that in the head or the direct spinal injury where the person came to you immediately after that condition or the accident has happened, directly take those patients for investigations like MRI, CT scan, which are basically needed for that patient, and we can really help that patient's condition before the patient gets worsened. So this was the topic from Dr. Borland's book. We had discussed about head or spinal injury topic today. The next will be about small wounds and the lacerations. So thank you and stay tuned with my homeopathic channel. If you have any kind of doubts, if you want any kind of topics regarding your doubts, if you want to study any kind of subjects which are related to the medical field, then also you can directly comment in the comment section. I will really help you. Thank you.